Hello everyone, I am Dr. Judith Tebengo, and in this video I'll be talking to you about certain things you're to expect at your antenatal clinic visits. A typical antenatal clinic visit would include some of the following. First is the physical examination. Typically during your ANC visits, your weight to be checked, your height to be checked. Certain abdominal measurements would also be done just to ensure that everything is going on well with you and your baby. Next up would be the blood and the urine test. Typically the review of these results, like I mentioned in the video for tests done during antenatal clinic visits, the PCV, that's the packed cell volume, and the urinalysis tests are done at every single antenatal visit, so the results of this will be reviewed by your obstetrician, and this would help them identify any potential health issues like preeclampsia or gestational diabetes mellitus, as the case may be. During the antenatal clinic visit, an ultrasound scan can be done just to ensure that everything is going on well and the baby is developing properly. The antenatal clinic visit is an opportunity for health promotion, so your doctor will talk to you about different lifestyle modifications, how you can modify your diet, eat healthy, and also work out to ensure that you're doing well and also ensure that your unborn child is also doing well. Depending on the particular situation, your obstetrician may also want to monitor your baby movements just to be sure that everything is going on well with your child and that your child is developing adequately. The antenatal clinic visit is a very important time to talk about birth preparedness and complication readiness. This is when you and your physician will come up with a birth plan, what your mode of delivery will be, plan about emergency funds, transportation, and everything, including labor. So all of these are conversations to have during your antenatal clinic visit. As the case may be, you may be required to do certain screening for genetic conditions, and this is usually peculiar to different pregnancies, so if the need arises, your obstetrician may require for all these tests and make sure that you do them just to be sure that everything is going on well with that pregnancy. One key thing that you should also look out for is to make sure that your fears, your concerns, any anxiety you have is properly addressed by your obstetrician. This is the time for you to ask questions. If you've seen something somewhere that you're not so clear about, this is time to bring it up so that all your concerns are addressed properly by a professional. These are just a few of the things that can be done during the antenatal clinic visits. Every pregnancy is different and usually is tailored by your obstetrician. Whatever care you get will be tailored based on what symptoms you have or whatever the case may be. Also, it's important for you to remember to document every antenatal clinic visit in the diaries provided on this app. This way you get to keep track of your pregnancy. You also get to have professional advice where if needed. Also, the app will remind you whenever certain tests or whenever your next antenatal clinic visit is due. With this, we've come to the end of this video. See you in another video.